Hello, my name is Maya, and today I will be discussing the virus herpes simplex 1, more specifically the diagnosis of HSV1. Protection from this virus is extremely important as normal testing is not recommended until 3 months post-exposure or a lesion appears. Causal agents. HSV1 is a linear dsDNA virus with an icosahedral capsid and spiky envelope of the alpha herpes viridae subfamily. It's found in the mucosal cells that undergoes replication in the epithelial cells. Herpes simplex virus type 1 typically enters peripheral nerve terminals and then travels back along the nerve to reach the neuronal cell body, where it replicates or enters latency. Here it establishes lifelong effects on the sensory neurons. The viral particles of HSV were viewed using an electron microscope, where we see the structure of the motor particles are composed of capsid plus a net-like tegument with no envelope. Picture A, which consists of 5 images, shows virus stripped of its envelope but is a typical structure. B shows an envelope virus untreated, and C shows a naked capsid. It's concluded that viral tegument and capsid but not envelope are sufficient in motility of the virus. Epidemiology. HSV1 is a global epidemic that continues to affect global public health. It's estimated that 1/3 of the world's population has experienced HSV1. HSV is neurotropic and prefers to hide in the nerve cells. It has unique pathological features that allows it to evade the immune system. This allows opportunities for other diseases, disease progression, neonatal encephalitis, and cancers. 1 in 1,000 newborns experience neonatal HSV, which is due to exposure during vaginal birth. Transmission. Lifelong infection established in the sensory neurons. The virus is transferred and segregated to the initial site of infection or to sites innervated by infected neurons, causing vesicular lesions. Spread through infected saliva, via shared drinks, cosmetics, or mouth-to-mouth contact. After about 3 days to a week, patient will experience mucocutaneous lesions, and before lesions appear, symptoms like general feeling of discomfort, fever, tender lymphadenopathy, localized pain, tenderness, burning, or tingling may appear. Here is a picture of the vesicular lesions that appear orbally. They are called alluvial vesicular lesions. This is a DNA replication image. DNA replication is extremely important to the HSV virus. Replication of the HSV1 virus is coordinated with the cellular DNA damage response repair and recombination of the viral genome and viral gene transcription. It modifies and adapts cellular proteins to facilitate productive infection. The image on the right represents the replication-dependent licensing of late gene transcription of HSV1 DNA. The image shows how HSV transcription initiation occurs directly after the replication fork. You can see the viral replication factors in gray. The image on the left represents the diagram of the HSV1 genome. Diagnosis. HSV1 is known to combat autophagy through the functions of the Y1 34.5 protein or IgG1 antibodies, which prevents formation of the autophagophore by binding to Beclin-1, a key factor involved in the elongation of the isolation membrane, and by redirecting a protein phosphate 1-alpha to dephosphorylate the translation initiation factor 2-alpha to prevent host translational shutoff. Testing for HSV1 is done using a PCR test, which is a polymerase chain reaction test. It looks for HSV DNA in a sample. HSV, when untreated, can lead to many other things like mentioned before. One being HSV, which is herpes simplex encephalitis. Encephalitis is swelling on the brain, and because HSV lies dormant near the brain, if left untreated, it can cause further damage affecting your central nervous system. Treatment and management. Beginning antiviral therapy is needed as soon as possible or as soon as a positive diagnosis is received. More research is needed for deeper insights to advance treatment, so at this time, management of the infection and antiviral therapy are the best and only solution. In an experiment to study effectiveness of an antiviral treatment, it was found that cells depleted of either P62 or OPTN were able to mount greater antiviral responses, whereas cells experiencing exogenous P62 displayed decreased virus yields. A commonly prescribed antiviral med will be valacyclovir. It works by inhibiting DNA synthesis and therefore prevents replication of the virus. Some common side effects include nausea, constipation, sore throat, and easy bruising or bleeding. As the infection is lifelong, it is essentially asymptomatic with mild recurring lesions occurring over a person's lifespan. In those who do not receive treatment, the disease can progress and become HSV. And when this happens, 70% of cases are fatal. The journal from my research that I found most interesting is the Emotional Discrimination in Humans journal regarding the HSV1 infection and the improvement it has with the help of antiviral medications. The article is interesting because it informs you of how important it can be to treasure your health. Most aren't aware that herpes is a virus that can cause more than just sores. It can be life-altering as it's an incurable infection. The article conducted an experiment with those positive for HSV1 with schizophrenia and those negative for HSV1 with schizophrenia. It also tested using the valacyclovir antiviral drug and a placebo medication, along with the standard antipsychotic medications. And it was found that those with HSV1 left untreated or using the placebo had significantly lower spatial memory ability and steeper temporal worsening. And for those who were treated using valacyclovir, saw significant improvement in cognitive function. In conclusion, herpes simplex virus 1 is a lifelong infection that can be led to many other diseases and complications if left untreated. With proper care and management, the disease can be handled. It is best to prevent this infection as it comes with other complications and risks.